So, ma'am, how would a person realize like they have type 2 diabetes? It's a big question.
Yes.
Like, even if it is found in adults and less in children, but what would be the first sign or indicator that a person should go and visit the doctor?
So it is recommended that every person who has high risk for developing type 2 diabetes, and when we say high risk for type 2 diabetes, so from our ethnicity reasons, like all Indians are at high risk, because India has a much higher prevalence and higher risk of getting diabetes. Therefore, all Indians after the age of 16, in fact, should check blood glucose every year.
Okay.
So the only way to diagnose it on time and treat it adequately, so that we don't land up in any complication, is to check for blood glucose test every year. Definitely, if you have a family history, that increases the risk even further. Definitely, if you think that your lifestyle is not up to the mark, which most of us fall into that category, we are all sedentary, sitting for more than 8 hours a day. If the exercise schedule is not in place, if weight is increasing or if weight is on the higher side, if a girl has irregular cycles or polycystic ovary syndrome, if a woman had history of diabetes during pregnancy, which is called gestational diabetes, that's a special category of diabetes which happens in pregnancy. So all these are additional risk factors for getting diabetes, and if these symptoms are there, then definitely one should do the test as every year. But I think everyone, it's not an expensive test, and it is cost effective to go and do a blood test for glucose fasting, and along with that, if possible, HbA1c level once a year.